Hi, I'm Tracy Durm, a nursing instructor here at Calhoun Community College. Today we're going to talk about IV initiation and blood draw techniques. When we first start initiating an IV, what we need is a doctor's order. So you'll go to the chart and find the doctor's order. This particular doctor ordered normal saline at 150 cc's an hour. So what we're going to do is we're going to find some normal saline. This is a bag of normal saline. This is 1,000 cc's or milliliters. This is a medication, so we want to make sure that we have our 6 rights: the right medication, right dose, right route, right time, those type things, right patient. So we look at the bag first, analyze the bag. We want to make sure that our medication is safe. So we're looking at it for clarity, making sure that it's not cloudy, there's no precipitate. The next thing we want to do is grab an administration set. That administration set has a number at the right top corner. This one in particular says 15 drops per milliliter. So that is our drop factor. When you do checkoffs, you will need this number. It could be 10, 15, 20, it could be 60. So make sure that when you're doing your calculation that you know what this number is on your administration set. It will not be found on the bag. It will be found on the administration set. You need to open the bag, and you do that by tearing at these little slits at the top. When you remove the bag, give it a gentle squeeze and make sure that there's no leaking. This is what I call the plug. We'll need that in a minute. Then we'll open up our administration set. At the corner it says peel. And this is what it looks like. It's got a piece of paper around it to make it all pretty. So we're going to discard that. And this is what it looks like. You've got the spike, the drip chamber, the tubing, the roller clamp, and then your hub. So the first thing we're going to do before we spike our bag of fluid is we want to roll our clamp down. What this is going to do is prevent the fluid from coming into our drip chamber down our tubing, because we don't want it on the floor. This is very important. We have to insert this spike into this hole, and it's sterile, so we want to maintain sterility. The way we're going to do that is be very careful of where these ends are going. We want to pull this. As you can see, it's kind of tough. I'm not touching that. There's the hole. Twist that off. This is your spike. Gently twist until it comes all the way. Now we want to make sure we've got this closed before we flip this bag over. Otherwise we'll have water all over the floor. Flip your bag over, hang it up. No water, no normal saline, no solution in here. What we want to do first is squeeze this chamber. We're going to fill it about 1/3 to 1/2 full. So it may take 1 or 2 squeezes. After we've done that, we're going to undo our roller clamp. And you can see that it's dripping into the tubing. Once the fluid has gone through all of the tubing, there's no air. I still have the end of this on. If I should take it off, it would go a lot faster. There's one little bubble here, and that's it. So when we clear the line, we're going to clear all the way to that second bubble. We don't want any air in the line. You can see dripping. So now I'm going to turn off my fluid. And that's it. We're ready to initiate the IV. Okay, now that we have our solution set up with our administration set, it's time for us to access a vein. The first thing we're going to want to do is go in and talk to our patient. We need to identify the patient. We need to tell the patient what we're going to do. and then we need to take or answer any questions that they may have to make them feel more comfortable. The next thing we'll do is assess their arm or assess for a good sight. And the way we do that is with some of the equipment that we brought along. This is an IV start pack or an IV start kit. We've got our gloves and we've got our catheter. This is a 22 gauge catheter. We're using that because we're only doing IV solution. So now that we have our equipment, let's take our tourniquet out and assess for a good vein. Well, when placing a tourniquet, it needs to go up high on the arm to start with because we want to see all of the veins. Later on, we'll put it 2 to 4 inches above our actual site. The next thing you want to do is you want to put the arm in a dependent position. Let gravity be your friend. If you still don't see something that you like, you can tap a vein gently, or you can put some warm compresses. Now, on this particular gentleman, I'll say, he's got several long, straight veins. You can see one here, and of course you can see one here. This is the most preferred. We want to start distally, and distally means the furthest from the body, and work our way proximally towards the body. The reason why we do that is we might miss. So if we miss up here, if we try to initiate it down here distally, we already have an injured vein, an injured vessel that this fluid now has to go through. So you want to start distally and work your way proximally. We do not typically choose the hand because it's rather painful. So for this IV initiation, we're going to use this nice long vein here. There's no valves that you can see, no lumps. It's not hard. It's very soft and pliable. There's no swelling. So this is a good choice. We've made our choice. We don't need to keep our tourniquet on for any more than 2 minutes, so we're going to take that off. Now we're going to go wash our hands or use hand sanitizer. We're going to put our gloves on. We're going to get our equipment out. And what you'll find in these packs, they're all different depending on your hospital. You should have an op site, and they all look relatively different. So you should see an op site, you should have something to clean with, and you should have some tape to secure the site. Alright, so what we need to do first is put the tourniquet back on. Now, I like to do the X tuck. That's what it's called. It's a slip knot. So you X, hold it, and tuck it in. Okay? You don't want to make a knot because you can't take it out very easily. So we do the X and the tuck. Alright? We're going to use this one here, and we're going to come up close to the elbow, but we're not going to go into the elbow because every time they bend their arm, the solution will then stop. So we're going to come up a little bit higher than this, but not quite to the elbow. So we're going to initiate in this area. Okay. This is chlorhexidine. This is our cleaning solution. And there's different types. You can have alcohol, or they may have chlorhexidine. Most hospitals have chlorhexidine. This one in particular, you pop. Get it, the gauze in the end wet. And per manufacturer's suggestion, we're going to use friction back and forth. And we'll let that dry. Now, if you have an alcohol, you're going to start in the center, and you're going to do a circular motion outward, about 2 inches. And we have our catheter, that 22 gauge we were talking about, fairly small. All right. This is what it looks like. You've got your chamber here, which is your flash chamber. It'll fill up with blood should we get into the vein. You've got this white button. Do not push the white button because that retracts the needle. It's for your protection, it's safety. We don't want to touch any of this part. That's sterile. That's what's going into the vein. And you'll see that you've got a needle and then you have this clear plastic catheter over the needle. So when you push this button, the needle goes in, catheter stays in place. Okay, so let's access our vein here. We'll come in at about a 30-degree angle. You want to put traction on that vein so it doesn't go anywhere, it doesn't roll on you. You can go over, you can go beside the vein. People do it differently. And as you can see here, I already have a flashback. The blood is coming into the catheter. So I want to advance it just a little bit more, about 1/4 of an inch. Then you'll advance the catheter, not the needle, just the catheter. Okay? After you've done that, you want to, what I call pop your tourniquet. You want to take off your tourniquet. You want to get your solution. You want to be very careful that we don't touch either end of this, the hub or the end of the tubing. We're going to place pressure on this vein here to stop the bleeding when I pull out this needle. So it's kind of hard on this one. I'm going to press hard. Push the button. Needle comes out. Tubing goes on. Twist it. I did not touch the inside of either of those. You try not to touch your site. You can see there's blood in there. You're in the right place. So now what you want to do is make sure you're in the right place. And the way you do that is to take your roller clamp and gently start the flow. You're not going to see it on this particular mannequin because of the pressure inside his artificial vein is greater. But if you'll initiate the flow, start it real slow, it'll open up and it should go through the valves and should flow freely. That's what you want to see. And you can see you're not going to see that in here. After you see that you're in the right place, you want to slow the rate back down. Don't cut it all the way off, just slow it back down. And now we're going to secure the site. We're going to do that with our tape. Do not cover the site with your tape. You just want to secure the tubing to the patient. The site is what the op site is for. You take your op site and put it right over the insertion site. Now you can still visualize it for any kind of infiltrations or infections, swelling, redness, those type things. Now this securing the line is the most important thing, minus you not getting your patient infected by contaminating the ends. This is the second most important part, because if you don't secure it well enough, they're going to pull it out and you'll have to start over again. So we like to put a loop down here. And if they're not allergic to tape, then use some tape. Then you want to put another piece of tape up here. Now, if he should pull the line, he's got to get through a couple of places before we actually pull the line out, and that's what we want. All right, so after you've done that, now you are going to actually count the drips. And if you calculated the 150 cc's an hour, it comes out to 38 drops per minute. Again, we're not going to see that on this particular mannequin, but this is when you would count that 38 drops per minute. Once you get it regulated, then you need to come back to your site. Okay, you can see here there's a piece of the op site that you can use to document who did it and when it was done. So this is the part where you want to put your initial my initials, the date, and the time. And you want to use military time, of course. That's hospital time. So I've got my initials, the date, and the time. So I know that, or when this needs to be changed. I know when the site needs to be changed, because that's where you're going now, is to document in the chart. And you'll document that you started the IV, what you started, when you started it, how fast the rate is, how did the patient tolerate it, how many sticks did you have to do to initiate the IV. And that's it. All right, we've got labs ordered from the physician, so now we are going to draw some blood. And we've got our equipment in the proper tubes that we need for those particular labs. We're going to go in, introduce ourselves, let the patient know what we're about to do, answer any questions that they have. Make sure you've got the right patient. Always do your patient identifiers, the 2 identifiers. We're going to assess for a good vein. So we're going to put our tourniquet on. Again, cross and tuck. We'll use the antecubital veins, and you see he's got a big one here. So once we've determined which one we're going to use, we're going to need something to clean it with. We're going to use alcohol. Take your alcohol and in a circular motion, clean the area, about 2 inches out. Now we've already washed our hands or used hand sanitizer, so I'm going to put my gloves on. And I like to go ahead and get my Band-Aid ready. Got a Band-Aid for the end and a little cotton ball. Okay, this is a vacutainer needle. This is a vacutainer, so now we got to put it together. You twist it and then twist it on. So now you're ready. Pick one of your tubes, slide it in. Now there is a needle in here that will puncture the end of that tube. There's a vacuum in here. So when you puncture that on the needle, it immediately sucks in whatever, air if you're not in the vein, or hopefully blood if you are. So we're not going to initiate that until we get into the vein. Remove the top. Push that down. This is also another safety device. When we get finished, we will lock this safety device over our needle. We're going to use bevel up. We're going to put traction on the vein. We're going to go in at about a 30 degree, right over the vein, and you'll feel a pop when you get in. It's a little bit more difficult than in initiating an IV because there's no flash. But you'll feel a pop when you get into the vein. Don't go any further. You'll go through the wall. The next thing you want to do is activate, I say, this tube by pushing it all the way forward. Now you can see that there's blood coming into the tube. You'll allow the blood to come in until there's no more. There's no more vacuum in the tube. Once it's full, and we won't allow this to get totally full, it'll be a while, and you need a different kind of tube for a different lab value, we are going to hold very tight the needle in place. Put that one to the side and pick up your other one very carefully. And we're going to push this one down onto the needle. And again, it's filling up with blood. Once you've gotten all the blood that you need, take your tube, set them to the side, Release your tourniquet. Get your cotton ball and take your needle out. Safety first. Cover your needle, put it to the side. Hold pressure, and if there are any kind of blood thinner, you may have to hold it for a little bit longer. And then apply your Band-Aid. And you can put that over the cotton ball if you need to. And that's it.